and welcome again to our channel.
Hello and welcome again to our channel.
Hello again, Kokwana Elta here. How are you? Hello and welcome again to our channel, Kokwana Elta, all the way from South Africa. We are driving on the garden route to Cape Town. So, well, I hope guys you are still safe. This corona is still here. We still have to play safe, right? If you are vaccinated, don't think you are safe. You will still get sick. So let's stay safe. Now, I'm not going to talk about the safety of corona today. I'm still with parents, new parents. They find it so hard looking after the newborns. Yeah? So it's our duty as Kokwanas, as grandparents, to talk to them about this, you know. They might get help. You know, the little knowledge we impart to each other, it helps. Right. The question is, do you watch Kokwana Elta's channel so that you get all this information? Eh? Knowledge is power. Neonates have got a lot of common problems, health problems. So I just want to go through those problems. Some of those problems, there might be many, but these are the most common ones I'm going to talk about. There are birth injuries. When babies are born, they go through that passage. It's a lot of work for them. So as they go through, they get compressed, they are pressed. Sometimes you find that the medical staff have to take some equipment to help them, like use forceps to pull or vacuums, things like that, to pull them up. Hey, it's a lot of work. So you find babies that has gone through that have some birth injuries, some bruises on the head, some swellings on the arms. So those will go away. It's not a lifelong thing that will stay there for long. But if you feel it's bleeding or it's becoming septic, if it was a bruise or whatever, consult your doctor. Most babies show signs of jaundice at birth. That is because of the immaturity of their liver to work on those bilirubin in the body. Baby skin color changes to yellow. Even the urine can be yellowish as well. But it will fade within about 10 days or so. It will disappear. And then some of them, they can be treated by just putting them under the sun, and then the jaundice will go away. But if it persists, seek medical help. Cough. Babies don't usually cough. Usually they cough when you give them food or they gulp food very fast. So it means it's like a choking. So you just pat their back a little bit, and then they will cough out whatever is irritating them. However, if cough persists, like maybe you find them keep coughing even during the night, seek medical help. Check with your doctor, your midwife. Right. Sometimes babies, you find that they've got a little bit of distress, or they'll breathe faster or something like that. That is because their lungs that are still premature. So you find that they have a little difficulty in breathing when they eat. So that will fade as well. They usually outgrow it in a week or 2 or 3. But if you realize that they are more distressed, seek medical help. Heat. Sometimes babies feel hot on touch, right? So check what might be causing the heat. Is the weather? If it's too hot, how is the baby dressed? You know, it's not always the case that newborn babies should be wrapped up and stuff like that, right? However, if high temperature still persists, try to cool the baby down, because if it stay high for some time, right, yeah, it might cause seizures. Seek medical help if you feel it persisting, even if you give paracetamol or fluids and stuff like that. So, however, babies need to be hydrated every now and then. Give fluids to the baby, and then it will flush most of the things out that might be causing the high temperature. Right. Sometimes babies have got oral thrush. Oral thrush might be due to maybe babies are taking some antibiotics. Some babies that are being bottle fed, you find that they've got thrush or coating on the tongue. There isn't much you can do, but my grandmother used to tell me that when I experienced that on my children, they said, you just dip a little bit of brown sugar. I don't know if it's a normal practice these days, but during those days, we just dip earbud on the brown sugar and then rub it on the tongue. And before you know, voila, it's gone. Others put sodium bicarbonate, but I wouldn't advise that. Heat rash, that when it's too hot in your area. So babies find that they get sweaty and develop some rash, red spots. It's not sickness. When the babies are cooled off and clean up, just keep the neck and the armpits, just keep the baby clean. Don't overdress them, let them dress light and stuff like that. Nappy rash, when you don't change baby's nappy too often, babies tend to develop nappy rash, and if it's not treated, it can become very, very bad and very, very painful. So what you do for this to prevent it, you have to just keep changing nappies every now and then. Yes, long time ago we used to use Vaseline on the bump. We said it was a barrier to protect. Yes, it worked, but the modern researchers, they said anything that we apply on the baby's skin might be absorbed through the skin because it's still immature. It can absorb those impurities to the body and then cause so many things that they say. So they recommend we should just leave the balm as it is, just keep it clean and dry. Keep changing nappy. If it's possible, leave the baby open down there. Okay. Another problem that babies usually have is distension of the abdomen, right? Sometimes when the babies eat too much or they have got too much gas, you find that the tummy is distended. But when you touch it, it feels a bit soft, right? So you don't have to worry about that, because when they relax and sleep and the wind come out, the tummy become back and soft. They won't be hard anymore. But if you touch that tummy and you find that it's hard and tender, it might be painful for the baby sometimes, and the baby might be crying. So in that case, seek help. Colicky babies will drive parents crazy because they cry. You find that the mother will be crying as well, and daddy will be crying, because babies don't talk. They don't say where is painful or where is not. So colic, it is said there is no concrete research that has been found to say it is caused by this and that. So many other things that might cause any discomfort on the baby. So the baby will just keep crying. So there is nothing you can do about colic. Others say you should give gripe water. That's what our mothers and grandfathers do. Others said just rocky the baby, calm the baby on the chair or whatever, try to calm them to sleep, or give a dummy. Hey, some people that are anti-dummies will kill me when I mention a dummy. Just to soothe the baby, let the baby go to sleep instead of exhausting the baby with crying. If you have given the food, the baby is clean, he is not overdressed, you feel is comfortable, give the dummy and let the baby go to sleep. I think so. Otherwise, colic within the next 3 months, so it should disappear on its own. Sometimes when baby are still small, some of their organs that are not really matured, so in that case you find that the babies show the sign of bluish discoloration, maybe on the lips or on the fingers, on the tip of the fingers. So if you notice that and it doesn't go within a week or so, you need to seek medical help so that they can check if the lungs or hearts are not working very well, little things like that. But as they grow, within few months, they become matured and then function well, and then all the things comes back to normal. Right. Whilst talking about that, again, there is anemia. Anemia is commonly seen on babies that their parents were anemic during birth, or maybe they lost a lot of blood, and then in that case you find that the blood supply to the baby was a little less. So if they look anemic, you let the doctor see the babies. How do you see anemia? Sometimes the tips, little fingers are just too pale, and then maybe on the buccal cavity it looks so paler than pink. Yeah, so if you notice that and you are not comfortable, you let your doctor know. Vomits. Babies usually vomit when they are after feeding, right? So when they vomit, it will be maybe with the wind. That is why we advise parents to burp the babies after feeding, because when you put them down, they will just vomit with the wind, and it might be a lot. Sometimes it's just a little bit. So to prevent that, we should just burp the babies effectively and let the baby bring the wind out. So sometimes babies vomit because of the type of milk. Sometimes they vomit because they are not well. So if it persists, seek medical help, because the baby might become dehydrated as well. Right. Another one, I know I said the last one was the last one, but it was not last. I keep thinking of more. So there is diarrhea. Usually is due to infection, or maybe the babies are taking some antibiotics. Again, some babies, when they take antibiotics, they have diarrhea. Make sure the baby keeps drinking, hydrated, and then of course seek medical advice for that. Yes, most babies do get constipated sometimes. Usually it's because of what they take in. Some formulas cause constipations on babies, and other formulas cause diarrhea. So you should play around your formula feed and see which one is good for your baby. Right. I think I've exhausted all of them. Remind me, right? I've exhausted everything. I think so. To conclude now, I will just say, we keep telling parents that even if there is a nurse looking after your baby, make it a habit that you bath the baby yourself at least once a day, or change the nappy, do the top and tailing. So just for you to acquaint yourself with your baby, like learn your baby, how is the baby, the head, Are there injuries? The mouth, all those things I was talking about, the oral thrush, the rash on the body, nappy rashes, is the abdomen okay? All those things, you see them when you change nappies or when you are handling your baby, bathing or doing all those things. So you'll be able to notice something that is not right about your baby and able to attend to that. So look after those grandchildren of ours. And I hope this helps. Now, if you have got some more information to add, please add it down there on the comment. Let's share with others. And then please subscribe to this channel because there are so many things to learn. So for now, stay blessed. We'll see you in Cape Town.